Hello, I'm David Ting. I'm the CMIO for the MGPO and a MedPeds doctor, and this is Two Things.
Hi, I'm Leslie Vensel. I'm a primary care physician and medical director at Mass General West Medical Group, and I'm a member of the Primary Care E-Care Advisory Team.
And I'm Tarik Alkasab. I'm an emergency radiologist here at MGH and also the IT informatics officer for the Department of Radiology here at MGH.
A couple of things that we're excited to highlight this time is to speak about the collaboration that goes on between our organizations, between our doctors here and our colleagues at the Brigham and Women's Hospital, for instance. One of the things that we've been collaborating on is improving the way we do documentation. And the radiologists have been really leading the way in helping us reformat the way our imaging reports appear in Epic. Tarik, can you tell us a little bit about that?
Sure. The radiology departments at MGH and the Brigham and the rest of the partners hospitals have been in the process of trying to unify and harmonize how we do all kinds of things. And actually, Leslie's husband, Bill, has been one of the leaders in that from the Brigham side, so it was a real opportunity for us to concentrate on that. And one of the areas that we've been most interested in is improving the radiology report, and specifically how it's formatted and how people see it. So we looked at how it was previously presented in Epic, and we talked to people like Leslie about how they consumed it. And what they told us is that they wanted the most important parts of the report up at the top. And so the impression, actually, which you can see here in the old version, is kind of buried in the middle and sort of difficult to pick out. We created a new version of the report which put exactly what kind of study you've got, the reason for it, the link to the images themselves and who ordered it, and the impression right up at the top of the report. So it's very easy for people to get to without having to do a lot of scrolling. And that's been really tremendously well received. The feedback on that has just been terrific, and we're really glad to be able to provide an easier to consume and we hope more valuable report for our colleagues.
Tarik, this is a real exciting development to put the impression up top in radiology reports. Leslie, how about in primary care and other specialties? Is there an opportunity to do a similar move?
Well, first, I just want to say thank you, and my husband, Bill Mayo-Smith, has listened to me complain for 30 years, and so this has been huge. And the fact that actually, I want to emphasize, this is now the standard report across all enterprise hospitals. So, in primary care, we have already been running with this, and we are indeed putting our impressions first in our notes. And we'll find that it's a lot easier when you go back to look at your own note, or if you're looking at a colleague's note, if your impression is at the start of the note, so you don't have to scroll down. And so we put the impression, the assessment, and plan right up front. And I would encourage our subspecialty colleagues to do the same. Some of them are already doing it, and it just saves boatloads of time and improves patient care.
You can imagine the boon of being able to open a specialty note and without scrolling through 5 pages of junk in Epic, you actually get right to the meat of the note. Now, Leslie, is this something that is built into Epic, or is this something that we do as a concept?
Well, you can set it up as your own note. Everybody's note can be set up to do it this way. It's quite easy to do.
Okay, great. Well, thank you so much. It's really great to see collaboration between our sister institutions and also our own doctors improving documentation even as we learn to use the EHR. Thank you so much.